This video covers the diagnostic criteria for Dermatosparaxis Ehlers Danlos Syndrome, or DEDS. DEDS is incredibly rare, with less than 1 in 1 million people being affected. We are going to review the new 2017 diagnostic criteria for DEDS. The formal evaluation and genetic testing are required for a diagnosis, which include major and minor criteria. Skin biopsy is mentioned below, but is rarely used as it can only rule out other types of EDS. To be diagnosed, a patient needs the major criteria of extreme skin fragility and characteristic craniofacial features. They also need one other major criterion and either one other major criterion and/or 3 minor criteria. They also need to be genetically tested. The major criteria one requires for diagnosis include extreme skin fragility, characteristic craniofacial features, prominent eyes, puffy eyelids, excessive eye skin, wide cranial sutures, hyperplastic chin or small chin, blue sclerosis, and large fontanelles. As you can see on the right, a fontanelle is the gap between the skull bones. For diagnosis, the patient needs at least one of these following major criteria: atrophic scars, severe bruisability, short stature, redundant skin, short limbs, hands and feet, perinatal complications, and increased palm wrinkling. For diagnosis, the patient can additionally have 3 or more of the additional minor criteria. Minor criteria include soft and doughy skin texture, refractive errors such as myopia, which is nearsightedness, or astigmatism, hypermobility as diagnosed with the Beighton scale, stretchy skin, tooth abnormalities, and hirsutism, which is pictured on the right. This is an abnormal pattern of facial hair growth in those assigned female at birth. Further minor criteria includes strabismus or crossed eyes, abnormal fatty tissue, osteopenia, aphasia, which are communication difficulties, and finally, complications of visceral fragility such as a ruptured diaphragm and bladder. Genetic criteria is also necessary for diagnosis. DEDS is autosomal recessive, meaning a child needs both genes to be affected. There is a 25% chance of passing on DEDS with each child. Gene associated with DEDS is ADAMTS2, which is a gene that encodes an enzyme that helps process collagen precursors. Mutations reduce levels of functional enzymes which interfere with processing pro-collagen. Accordingly, networks of collagen are not properly assembled, which weakens connective tissues and causes symptoms of DEDS. This is the end of the diagnostic criteria for DEDS. Please click the like and subscribe button if you'd like to learn more about Ehlers Danlos Syndrome and other rare conditions. You can also follow me on Instagram for more regular posts at chronic.care. Thanks for watching. Stay rare.